The Greenwich Children's Occupational Therapy team works with children and young people from 0 to 19 years of age who experience difficulties in carrying out everyday activities. Occupational therapists call these activities occupations, and they include self-care, play, socialising and things children need to do at school and at home, such as sitting, writing, eating and dressing. Occupational therapy helps children become more independent in these activities. We work from 3 main bases in Greenwich: Goldie Lee Hospital in Abbey Wood, Ferryview Health Centre in Woolwich and Wednesday Close in Eltham. We also work within nurseries and schools, including special needs schools and on occasions in families' homes. Children are referred to us by paediatricians and other healthcare professionals, and also by education staff. After a child has been seen by the service, a re-referral can also be made by parents as well. When we first see a child following a referral, we carry out an initial assessment in which the occupational therapist will look at how the child uses their hands to carry out tasks, how they move, sit and stand, and their ability to do a variety of activities. We will also look at the underlying skills required to do these activities, such as the child's visual perception, how they move their body, and how they interpret sensory information from the environment. Children's occupational therapists use a range of assessments and observations, as well as discussion with the child, parents, and where appropriate, the school. Our early years service for children aged from 0 to 5 focuses on the basic skills that a child needs to be able to play, such as positioning, seating, and hand use. This includes the skills they will require for going into nursery. We also work with parents to address any difficulties they may have with managing their child's daily activities, such as bathing and dressing. Our mainstream school service works with a wide variety of school-aged children. This could include working with children to help them to access the environment as independently as possible. For example, if they're in a wheelchair or if they require specialist seating to maintain their posture to enable them to concentrate on learning. It could also include working with children who may have coordination difficulties and find it difficult to sit still and concentrate, or to use the tools they need to use at school, such as pencils, scissors and rulers. Occupational therapists will work with children to develop the underlying skills needed for these tasks, such as making sense of their environment, strengthening activities, looking at a range of grasps and how they use both hands together. Alternatively, we may also look at adaptations to the task or equipment so that children can achieve success. For example, we might look at move and sit cushions, weighted pencils, pencil grasps, spring-loaded scissors, or we may liaise with schools about using alternative methods for children recording their work, such as using a computer. We work very closely with our children's therapy colleagues, such as physiotherapists, speech and language therapists and music therapists, to deliver integrated services where possible. We also work very closely with the local authority who commission part of our service, and we have very close working relationships with the schools in our borough.
In school we have commissioned occupational therapy for a number of years now. The occupational therapist works in class with individuals, groups, or in some cases whole classes of children should the need arise. The occupational therapist is working with the children to develop the necessary skills that they need to be successful within the school environment. Occupational therapy has had great impact in the school. We now have a very effective handwriting policy. Individual children have grown in their self-esteem, and this has had a direct impact on the children's handwriting skills and also on their test results.
Following assessment, a child will be given advice if required, or they may be offered a place in a group or a short block of individual sessions to work on the difficulties that we've identified. Children are encouraged to learn skills by practicing them on a regular basis within their daily routines and activities. We also run regular advice clinics where children who've been discharged and their families can come when they feel they require further advice or ideas for activities.